these heterosexual black men, they don't get to tell their own stories. The stories are being told by others. So with the study, we give them the opportunity. We let them speak. We let them actually come out and say things the way they see it. This gives us the real data that we could use, because it's actually important that the policymakers and the decision makers actually understand what to do. But to do that, you actually need to talk to people who are living the situation.
As a young black male who's been involved in the HIV community for the most part of my life, a lot of the programming, a lot of the researching, everything that you see kind of caters to almost every subgroup except for male, and particularly black males. And so to see a project like this one that is specifically addressing like me was very different, right? And something that let me express myself like through my lens.
If you speak out, there people know that you need help. A lot of us need help. We cannot say it out because of fear of being tagged and fear of being segregated again. Already we have suffered enough segregation, so we don't want to go to that.
We've been told men don't cry. Basically, that is what it is. So even when you are suffering, there is no space for you to be able to share what is going on with you, whether it's a mental health issue, whether it's issues related to drugs that may be having a struggle, maybe issues with HIV, or so many other stuff, right, that sort of affect men's health. So what the weSpeak did is to provide a space that is needed for men to be able to have a conversation about issues that affect our health. In a nutshell, that's why West Community Health Center signed up to become a collaborator with the host study.
We don't often hear from men and their health needs and the gaps and how they navigate healthcare. So this was a really, really important milestone for the African Caribbean Black community and the RVU and the partners in this research project. It is a one-of-a-kind, unique, multi-city, which is also amazing that, you know, it spans like 4 cities, to be able to specifically speak to men and engage men in the conversation around their health, and specifically around HIV prevention, which is something that we really value and need the dialogue and need the information. We need the findings to be able to design and develop programs and services that address the challenges.
So we set out to not only mobilize black men, but to engage them in actually doing the research. And over the last 5 years, we have engaged over 2,000 black men. We wanted to work with them to develop tools. We wanted to collect data with them, help us in the design. And so why I'm emphasizing on this is because it then informs the methods that we use to engage them. The methods we use to synthesize or to really analyze even existing evidence so we can use it to create knowledge translation tools. We also wanted to understand the issues of black men at the individual level. We wanted to understand it at the systemic level, at the institutional or community level. All of those levels were important because when you look at previous work, the emphasis is more on that individual level and behaviors of that, like vulnerabilities in terms of behaviors and action, but we haven't looked closely at the structural factors, the barriers at the structural level, at the systemic level that impact on black men. So those were all key areas in terms of the objectives that we wanted to look at. How did we go about doing that? Community-based participatory action research. It's a key part of how we do work to meaningfully engage engage the people that you are examining, because that helps us to look at the critical intersections of these multiple factors, whether it's age, gender, migration status, different things that impact on the experience of black men.
It included a qualitative aspect as well as a quantitative aspect. So the qualitative parts involved focus group discussions as well as in-depth interviews, because we just didn't want to have the surveys, but wanted to understand their perspectives from a qualitative part. So the surveys also captured some variables like condom use, the number of sexual partners. Focus group discussions were very interactive, and the participants were very free to express themselves. And after these findings were collated, there was the concept mapping, which is an innovative type of knowledge transfer and exchange. So in this regard, the discussion is more like participant driven. So when the researchers presented the findings to a sample of the population, we wanted to hear from their own voices or their own words, their perspective about the findings. And based on their responses, concept maps were generated, which would be used to develop best practices that will be used to inform policies and programs that will help to improve the situation in Ontario as a whole, and even extended to the whole of Canada.